Hi, my name is Levi Snell. I found Dr. Corey Nguyen on Google. I searched for a good TMJ specialist. I went to a dental surgeon. They told me to look for a TMJ specialist. Found Dr. Nguyen, and he told me I was tongue-tied. Didn't even realize it. No one ever told me that I was tongue-tied, but it complicated my breathing, caused me headaches. I would lay down at night, my tongue would slide over my throat and I couldn't breathe. I would wake up every 10 to 15 seconds, half suffocating. My fight or flight would kick in and I would never be able to get a truly deep sleep. He performed the surgery. It was in and out. It took maybe 20 minutes, and that's with the start through the finish. He numbs you, he snip, 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 cuts it out. You can talk the same day, your tongue's a little sluggish, but afterwards, the biggest benefit was psychological, because my mind knew that my tongue would no longer cover my throat when I fell asleep. And that was the biggest thing. Whenever I would try to go to sleep, I would try to sleep on my side, try to sleep on my back, and I couldn't breathe. I had to wear a mouthpiece. It made my jaw sore, made my teeth hurt. I could wear it for 2 or 3 days in a row, then I would have to stop, and then I would go back to having issues with OSA. So when Dr. Corey took care of that tongue tie issue, it was life-changing to say the least. I can breathe, I can operate, I can actually get the amount of oxygen I'm supposed to get at night. Instead of waking up every 10 to 15 seconds on average, I can get a full deep sleep. I actually have an app that told me I got 90% deep sleep on the first night I didn't wear my mouthpiece after the surgery. I couldn't believe it, but now I do believe it, because my life has changed completely. I mean, you can start with the neck pain going away, the shoulders relaxing, but that's just what you feel. The main, like I said, going back to it, the main benefit is it just opens up your brain, because now you're running on all cylinders. Instead of having to reserve enough energy to do one thing or the other and being tired at the end of the day, you can do what you need when you need, and you're not stressed about getting it done. So that's the main benefit I see, but there's so many other things, from just being able to have a conversation with somebody without having to worry about running out of breath because your tongue's in the way of your throat, or, having to think at work. I work on site with a customer, so I have to be able to answer things just like that. And with this amount of OSA caused by my tongue being tied, I didn't even realize how it was affecting my ability to do what I needed to do every day. You will have to learn to use your tongue again if it's as bad as mine was. But yeah, I could go on and on, but I'll keep it relatively short and sweet. Even if you don't know if you have tongue tie, if your tongue is tied or not, come see Dr. Corey, let him see what he can do. If you have issues with not being able to sleep, if you feel like you're always tired, always sluggish, if you have a headache, your neck hurts, your back hurts, you feel like you don't have enough energy at the end of the day, and you've gone to different specialists trying to figure something out. Dr. Nguyen just opened my eyes and freed up my tongue.